So the last couple of days I've had a lot of people with rib issues, and can chiropractors help out with rib issues? Now I'm an upper cervical chiropractor, but I can still help out with rib issues. And I want to explain to you why that might be the case so you understand it. Okay, so I'm going to use this little part of the board right here to explain it. And if you have a rib out, it's a terrible joint in that it's more like two fingers sticking on top of each other like this. When we think about joints, we think about hip joints and shoulder joints looking something like this, right? But this joint is a specific type of joint, and it has a little bit of fascia around it that's holding it in place. So when anything gets out, man, this sucker gets fired up, and it can produce pain that goes all the way around the side of your body. So if you've got pain that shoots around the side every now and then when you move, and nothing's kind of getting out, but you kind of feel like your back is not sitting correctly, could be a rib issue. And they're fairly straightforward most of the time to get going, especially the younger the person, the easier it is, right? So I'm going to draw a vertebra, and I'm not the perfect drawer, but you have a spinous right here and transverse process right here, okay? And then you have these pedicles that come off here, and then you have the vertebral body, the main part of the spine, right? In that, you've got this space where your spinal cord exists, right? So most of your vertebra, for the most part, looks something like this. Your thoracic vertebra. And on that, the rib kind of comes in as a position like this. And so that is kind of normal. If everything's looking normal, the rib's kind of in a position like that, and it wraps around the body, of course, at that point, and comes around that way. Now, if you have what we call in chiropractic a subluxation, right? It's not dislocation, it's a slight out of place. Then that vertebra can be like this. So there's the spinous, there's the TPs, pedicles, and then you've got the spinal cord in that area there. Well, when this happens and the ribs are normal, then it can do this, and it breaks kind of that joint. It's still kind of wrapped around it, but it gets fired up, and it can fire the intercostal nerve that comes in between your ribs, okay, and make that pain shoot around the sides. So what we do is adjust it the right way, and we get it straightened back to this position, and it settles down the rib. And occasionally there's a rib adjustment that we do that's very gentle and very subtle. I can use instruments to do it too, and to get that rib to kind of sit back in the correct position. Normally when I get this done in my patients, they go and want to test it, right? And then they go put themselves back out. So it's very important that after those adjustments you sit straight and take care of yourself. Usually this is happening in this region of the back, the lower thoracic area. Almost is notorious for it because we tend to lean forward, we're pushing everything out, and then we twist and we get our back out of place. So we go through training in order to put this the right way. You got to understand where to contact, where to put the force, and that's what we're trained in this environment. So, hey, if you got any of that kind of pain, or you know somebody who's complaining of that kind of thing, come in my office, we can rehab you. I'm the gentle chiropractor. We hardly ever use a lot of force. We use a very gentle drop table for most of the adjustments. No twisting, no talking, and I'm an upper cervical trained, so for the neck we only use instruments almost all the time unless somebody is really stuck. And that is very, very rare in my office. So our number is 678-649-8569. Give us a call and we can help you out. Take care.